chest wall perforator flap is a surgical technique by which we can improve and enhance the appearance of breast after a breast cancer has been removed as lumpectomy. One of the treatment for breast cancer is lumpectomy. When we take the breast cancer out, which is slightly on the big side, or is situated in the inner part of the breast or lower part of the breast, the long-term cosmetic outcome of such surgery can be a bit compromised. Over the years, we have developed a technique by which we take the excess tissue from the side of the breast and also underneath the breast, and then advance it into the defect that is created into the breast after lumpectomy. So when we close the breast after operation, the breast appearance looks excellent and there is no cosmetic defect. So this is a technique which is extremely valued by patients and provides excellent outcome after breast conserving surgery, commonly known as lumpectomy. In order to be a candidate of partial reconstruction of chest wall perforator flap, you need to have some extra tissue or skin fold in the lateral part of the breast, which is the outer part of the breast underneath the armpit. And also you need to have tissue below the breast, because these are the folds which we need to raise and advance them inside the breast so that they cover the defect created by lumpectomy after removing the breast cancer. So patients who are very thin, this is not a suitable operation for them, but most women do have some extra tissue, so they are suitable for this operation. The perforated flap procedures are based on where actually you take the tissue from. So if you take the tissue from the inner part of the breast, this will be a medial intercostal vessel. So we call it a MICAP flap. If you were to take tissue from the outer part of the breast, which is the lateral part of the breast, then we use lateral intercostal vessels, and it is called a LICAP flap. So it all depends where we take the tissue from. Partial breast reconstruction with chest wall perforator flap is carried out as a day case. You can go home the same day. You will be independent and self-caring, should be able to look after yourself, make yourself a cup of tea or warm up a meal. You will need some support and help for the heavier activities. Most people are back to normal activities within 2 weeks, but full recovery can take up to 6 weeks. We all have a bit of excess tissue on the outer part of our breast underneath the armpit, which is the lateral skin fold. And then most women have got some tissue in the lower part of the breast. So when we raise this tissue, we try and do our best to hide the scar in the bra line. So when the tissue is raised, we transfer the tissue into breast, and then the donor site is closed with a scar lying. In most patients in my practice, the scar lies in the bra line, which means that once you are dressed or in bra, nobody will be able to see the scar. And the donor site is brought together in such a way that you do not have any dent or defect there. We plan it in a way that all the tissue becomes nice and smooth, so you don't have any dents. Chest wall perforator flap is largely used for partial breast reconstruction. If we were to do mastectomy and implant-based reconstruction, then women have to have a foreign body inside their breasts. Implants need to be replaced after 10 to 20 years. But when we do the partial breast reconstruction with chest wall perforator flap, we are using the natural tissue. We are using the tissue that comes from the patient. So if patient puts on weight, the breast puts on weight with the chest wall perforator flap. If patient loses weight, then The chest wall perforated flap also loses weight, which means that the appearance of breast remains in accordance with the patient's body shape. Whereas with implant, with its weight changes, the breast shape may remain exactly how it was in the beginning, so it may not look exactly symmetrical.